When you ask your psychologist, your therapist, your counselor about whether they have experience working with people who have the same problem as you, sometimes they might give you an answer that is not an emphatic yes. And that could be because maybe they have just started their practice, maybe they have just graduated from school, and they do not have that much experience. That does not mean that they are bad therapists. So you need to understand two things. Number one, before a therapist graduates, ordinarily, we go to attachments. And that attachment is not just at filling forms and sitting and just imagining you're a psychologist. Actually, our attachment, which is called practicum, is usually very intensive and very integrative in the sense that you work with real clients in a real setting. We don't work with fake clients, and by fake I mean like people who are just pretending to have a problem so that we can practice. That's not how it works. So when you go to like a clinical setting, you're going to find counselors and psychologists who are in practicum, but they will treat you like a real client because for them, this is a real job. When we go to practicum, we don't go to work with clients who are pretending. We deal with real clients with real issues. So even if your therapist has not dealt with your specific kind of issue in therapy, like after graduation, it does not mean that they have not dealt with it in practicum. The other thing that could be useful is understanding that if your therapist has not dealt with people with a similar problem as yours, they could be getting something called supervision. Supervision is when a therapist is working with somebody who is more educated, more experienced, somebody who is more advanced in the profession, and this experienced psychologist is helping them address the cases they have in therapy. A good example is if I am a psychologist who has never worked with a client who has an eating disorder, and you come to me because you have an eating disorder, I could get supervision to help you with that eating disorder. And this means I would go and look for a psychologist who is more advanced, somebody who has worked with eating disorders. And then either I could refer you to them directly, or I could start working with you under their supervision. So they are helping me understand how to help you. And that is what supervision looks like. So if your therapist has never worked with anybody who has your kind of problem, try to understand from them if they are in supervision or if they are going to get supervision or consultation about the case that you guys will be addressing. Again, at the end of the day, an eating disorder is not a problem that exists in isolation. It's a problem that exists in the same context as your other problems in life. So just because your psychologist has not worked with eating disorders specifically does not mean they have never worked with life issues. And if they're getting supervision, they might be able to help you with the problem that you have. Again, you have to decide if that is a risk you want to take with this particular issue that you have, or you want to go just directly to somebody who has actually dealt with the problem that you have. So it's more about deciding for yourself if that is the path that you want to go.